Hello, I'm Randy Swallow. Welcome to COVID Conversations. On this show, we'll meet two community leaders who have lost loved ones to COVID, people near and dear to their hearts. Joining us today on COVID Conversations is Robert Twix Taylor and Denise Ogletree McGuinn. Thank you both for being here and sharing your stories. Denise, you're a doctor, a PhD, a reverend, a nurse practitioner, a retired Army officer. Your days spent mostly in healthcare nowadays here. How has your life changed since COVID has come along with your patients?
Yeah. Well, you have to think a lot more, and you got to be really sensitive, because the question is a lot of times, and I always ask myself, especially even before I go, who has COVID? Who doesn't have COVID? I now work in the setting that the majority of our patients, they do not. But before we had the vaccines and all the information we had before, generally you used to go to work and you could just go to work, not think about it or anything. You know what you had to do. But when COVID hit, it was a lot of trepidation because you didn't know who had what. And that included your colleagues. Just going to work, you're thinking, oh my gosh, who have I been around today? Especially if you started to maybe cough or you just didn't feel well. That was my biggest thing. Is sometimes there were days I didn't feel well. And so the next thing to think about was, oh gosh, I got to get tested. So you had to kind of plan a little bit better, and you had to think a lot more. And you had to think about the people you were around. And also, a lot of times, I think one of the biggest things I had to really stop and think about is touching my face. Even though I may have washed my hands, not touching my eyes, not touching my nose, not touching my mouth. And then when I go home, getting out of my clothes in the garage, not wearing shoes in the house. You had to really stop and think about a lot of things.
Robert, you're the owner of Fatum All Barbershop, and at a recent community event, you said the barbershop is a place of transparency, truth, and debate. Now, I imagine there's been a lot of debate about COVID-19, boosters, vaccinations. Tell me about it.
Yeah, so like you said, that is a place where those conversations happen. And in a barbershop, we allow everybody to be transparent and have those conversations, as long as you're not disrespecting anybody else. So when it comes to vaccines, it is a daily topic. Before the vaccines were available, COVID itself was a daily topic. When the vaccines came out, that's a daily topic. So my whole job is, as everything else, I'm trying to give the community the right information to put them in the safest environment for themselves and their family.
Have you had COVID?
I did. Yes, I did. I had COVID pneumonia, and last November, so 2020, and it was a crazy experience. I passed out in line to take the test because I felt that my taste buds had left me, and I didn't feel sick or anything, but I can't taste anything. So I told my woman, let's go get tested. We went down to Cashman Center, and while in line, I went from cold to hot, and I had no oxygen. And I passed out right there and got rushed to Valley Hospital. And I was in the hospital for 2.5 days. And that experience right there, I believed in COVID. I knew it was real. But that right there really put emphasis on the importance of being safe. And once the vaccine came out, that's what made me, go towards that way.
Denise, you also said something very interesting at the same forum. You said COVID and vaccinations, testing, this is not a political issue. Explain that statement.
It's not political because it goes back to just common sense and public health. The bottom line is, do you want to live? And then when you think about it, even before the vaccines, that was the biggest thing, is everybody was afraid, am I going to get it and am I going to die? So that's when I started thinking about it. Do you want to live? And how bad do you want to live? And then when the vaccines came, people were kind of afraid about, well, what is this that they're going to put in my arm and what's what? But again, how bad do you want to live? And not only do you want to live, but the quality of life. Do you want to be able to, you think about during COVID, we couldn't see our loved ones. You couldn't have Christmas celebrations. You couldn't have Thanksgiving celebration. You couldn't get together with friends. There's just so many things we had to rethink. Things we took for granted, to just go see people. Right. Just to hang out with your friends, maybe to go have coffee or go to a meeting or even go to work. So it's like about life, because especially as we started hearing about people dying, it's like, oh gosh, am I next? And so it kind of goes back to what you were saying. It's like, if there was something different about yourself, you want to go get tested.
Right.
Denise, you also said something that just floored me at that same event. You said you've had 22 friends die, ranging in age from 15 to 95. Talk to me about that.
Well, when COVID kind of first started, you would hear about people getting sick, but then I started getting phone calls about from people, and one of them was a friend, and her son passed away. He and his wife both got sick, found out they had COVID, and he passed away. Then in my own practice, I would test people and find out. It's like mothers would say, "Oh, my kid's got a cough, he's got a cold, whatever," and nobody really knew. Of course, then we didn't know the test, but we found out more about it, and there was a test. We did some random testing, and that's when I started seeing, oh my gosh, all these kids have COVID. Then I got a call from a parent that I hadn't seen them for a long time, and she says, "My kid's in the hospital," and she said he's got pneumonia. And I'm like, okay, I said, hopefully they're taking good care of him and everything, and they're doing everything. That again, we didn't know much about COVID at that time. And the next thing I know, 2 days later, she called me and she said he died, and he was 15 years old. And then as time went on, you'd get this person, you'd find out, and in between it, you're going and getting tested yourself because I have allergies, but I thought, well, what if it's not an allergy? Right. I didn't have the loss of taste or anything, but one day I just kind of had this cough, and I just felt really bad. And I went to one of the local clinics and got tested. I didn't know what was going to be involved. And when I went there, they're all in these suits, and that was kind of scary. Right. They're all hooded and all this stuff, and they got oxygen. And I'm thinking, oh my gosh, this is really, I mean, I knew it was real, but then I knew it was really real. And while I'm sitting in that room all by myself, and all they can do is issue things, all I needed was a robot. Right. And they would issue things to me, but there was nobody in the room but me. Pretty scary.
Robert, you also gave a powerful testimony about your business partner, Patrick, who died in his mid-40s. Tell me a little bit about his story. Was he vaccinated, and how it affected him, you, and his family and loved ones?
Thanks for asking that. It's affecting me right now still. So Patrick, he was my business partner and became like my brother. We both owned Fata Mall, Summerlin, and Ivory Salon on Sahara. And we actually were the first ones to throw a vaccination event at the barbershop in Nevada, right? And I had a lot of pushback from that, and I'd explain why I was doing it. The same way I do everything else for the community, that's for the community also. So the bad part about it is he ended up catching COVID 2 days before the event at our shop. So he couldn't come to the shop because he had COVID. And, Patrick is a veteran, strong person, no problems, in his mid-40s. So we thought, okay, he'll pull through it. So he stayed in the hospital for 5 weeks total. He was there for 1 week at the VA hospital, which is a great hospital. He was there for 1 week, and then he made them check him out. He thought he felt better. He's like, I want to go home. He went home, and then it got worse for his breathing. Then he went back to the hospital and was there for another 4 weeks. And they actually allowed me to see him on a Sunday. And I knew that was bad news because they don't let you see anybody with COVID. So they allowed me to see him. When I saw him on Sunday, I prayed for him. And he was they had him intubated, so he couldn't, hear me, I don't believe. So I just, prayed for him, and the next day he passed away. And it's a tough one because, like I said, he's like a brother to me, and we own the business together. And it's just the irony of him not being able to have the chance to get the vaccination at the barbershop, which he actually owned, and then to die from it is just so surreal.
You're very much involved in the community. Why did you have that vaccination clinic there? Why is it important for people such as yourself in the community to set up places like that?
I believe it's very important to do the Shots to the Shop initiative because, one, I'm here for the community in general. I've done everything else, free haircuts for kids. When the shops got shut down due to COVID, I opened my shop up only for pictures for seniors, free. Because that was needed because a lot of photography studios couldn't do pictures during COVID. So I had photographers donate their time to take pictures. So when it came to the opportunity to have vaccinations at the barbershop, I said, you know what, I'm gonna do this. And a lot of people, hit me on the inbox, social media, why are you doing this? And I explain why. I'm like, I'm not here to talk you into anything, but I do want you to live. So if this will help you, for you to be living and make sure you take care of your family, I'm going to give you the opportunity to get the vaccination. That's why I did it. And a lot of people that went back and forth with me ended up thanking me for doing that.
Denise, why do you think this is in the African American community? There is mistrust plays such a big role for people that are vaccine hesitant. Why do you think that is?
It goes back historically.
Yes.
Goes back to the Tuskegee study. You know, and a lot of times people don't even realize that there was also a Oslo, Norway study, but the one that counts the most is probably the Tuskegee study. And then there's been other times that probably aren't even documented. But of course, in that study, you know, they were studying them for syphilis, watching them, and then when they actually had a drug, an antibiotic for it, they didn't give it to them because they wanted to see the long-term effects on the body. And the African Americans that were in that study were chosen. They wanted to see the tertiary, the long-term effects, and they were never offered the opportunity to get the antibiotic for treatment. So a lot of times with African Americans, when they go to majority culture or Caucasian doctors, they don't feel like they hear them or see them. But there's a distrust because of history, and it goes back to slavery, because people have lied to us and haven't told us the truth. So here comes COVID, and of course before that there was AIDS.
Right.
And so they thought that, oh, well, AIDS was designed maybe to kill us, to take us off the planet. And so here comes COVID, and it's like, oh, gee, AIDS didn't work, so you're going to come up with another one to take us off the planet. So there was a distrust. And then they didn't know much about it. And so that's why there's maybe resistance, there's hesitancy. Maybe sometimes they don't always now, especially with social media, whatever, they get this story or TikTok or whatever. And so they hear, oh, well, gee, I'm healthy. My friends didn't get it, or they got COVID and they lived. And maybe a lot of times they just don't know. And now we see it, it's not just African Americans. We see it with Hispanic Americans, Asian Pacific Islanders. We see it in Caucasian. It's across the board in America. It's like, well, gee, I don't know enough about this shot. It's like, it hasn't been out there long enough, so I don't trust it.
Robert, we'll pick up on that. And with there is so much misinformation out there. How do you separate from this in your experiences from so many people that you talk to?
Thank you. I'm glad you said that too. Memes, like anybody under the age of 40, they're all on social media. And a lot of people take memes as intangible information, which it's not. You know, memes is something somebody made up and said whatever they wanted to say. And then people spread those, almost like a virus. You know, and people spread that information, and people constantly in the barbershop will try to combat facts with a meme. Then I make them go back, no, let's look it up. Oh, I didn't know that. And then sometimes when people believe in something, they don't want to feel they were wrong. So that's the hardest part, convincing somebody that the information you read was wrong. And I try to explain to anybody who's anti-vax, we all have the same goal. We all want to live. The reason you're anti-vax is because you want to live. The reason people would get vaccinated because they want to live. We got to figure out that disconnect and put us together. And that's when it comes to researching and seeing facts and actual numbers. And when they see the numbers, a lot of times they're like, okay, I didn't know that. Okay, I'll think about it. And then they will know, did you get the vaccine? Yes, I did. Oh, okay. My first event at the barbershop, we had black nurses, which is very important because they wanted to see people who look like us giving it to them.
What other myths need to be debunked? What are some of the crazy things that you hear?
So one of the I won't say crazy, but misinformation that spread out there was one of my nephew, who's a barber also. His client was like, "I heard you get the vaccine that you're magnetized." So in my barbershop, all our clippers use guards, and guards have magnets on them. So I said, "Oh, is that the case?" I said, "Well, I just got mine." I gave her the guard. I said, "Put it on my arm." She put it, it dropped. I said, "Do it again, just to make sure." She did it again. After that, she didn't know what to say. And I said, "Listen, I'm not trying to make you look bad or silly. I'm not about that. I want to let you know that's wrong information. And I'm showing you the right way. That's not true." And now she understands that's real. But, you know, we don't have time to show each and everybody that it's not real. I just want people to do the information and research themselves.
What do you say about that, Denise?
That is probably the perfect one. It's the magnetic. There's just so many of them out there. It's like the biggest one always is it's not real.
Right.
It's a hoax. We're all still here.
Right.
It's a hoax. Or if I get it, it's kind of like with the flu shot. If I get the flu shot, I'm going to get the flu. First of all, like you said, you got to go to the facts. The flu shot doesn't carry a live virus in it.
Right.
Same with COVID, and that's what we explained to them about COVID. There is no COVID in the vaccine. It just teaches your body. It's like when that virus, if by chance it's encountered, it says, that's a foreign substance.
Right.
And I've got antibodies to say, go away. get away from me. Or either I've got antibodies that say, I'm strong and I'm going to be healthy. So I'm kind of going to rebuke you,
Right.
kind of like
Right.
rebuking the MIMS and the myths.
Right.
But we got to and it starts real simple. And you know what I always tell people is like, my favorite thing is I always think about myself when I got my vaccine, February of this year. I didn't know a lot about it. I heard it was time to get it, and I go, okay. I have this thing in my head, kind of from the minister Joyce Meyer, do it afraid. I was reading everything I could. I took an ice pack with me, another ice pack. I had Benadryl.
Right.
I had Tylenol, maybe because I'm a nurse practitioner. But I thought, let me just freeze my arm before I get in there. And I didn't. When it came time for me to go, I kept stepping back. I said, no, give me another minute. It took me about 20 minutes before I could even step up to, after I filled out the paper, I go, okay, now what are your qualifications to do this? And I asked still more questions.
Right.
But I froze in my arm and I said, you know, generally you say wait 15 minutes. I said, I'm going to do the 30 minutes. But I said, you know what? I am scared as all outdoors, but I want to live. And I said, if by chance I start getting sick or whatever, I want to know where are those nurses and those doctors here? Where's that ambulance? Where's all the stuff? I had my husband there and he was out there waiting. I said, and you got to make sure my husband knows. I said, if I start anything, and I had a whole list of stuff. And I know they were tired of me.
That was good
But
though.
I finally did it. And so when I looked around the room, one of the things that concerned me, because I thought about that myth, there were very few people in the room that looked like me. But one of the things that I did find, in fact, that night, it was some of the best sleep I've ever had in my life. But that week when I went back to work, people were saying, well, you know, this vaccine, I said, I got it. And they were like, you did? Next thing I know, all these people are signing up to go get the vaccine. But I think what you said, it makes a difference.
It does. Lead by example.
And I did hear that, oh, it's magnetic. And I was like them. I said, well, gee, I find it amazing that this is a room that's got all this stuff and I'm not sticking to the wall.
Robert, it's approximately 65% of the entire Clark County population has received at least one dose of vaccination, 39% in the African American community. What's your best message to people in the African American community and any community to get vaccinated?
Okay. Something I say in the barbershop all the time, because a lot of clients will say, well, Blasey Blah got the vaccine and still passed away. That's why I'm not getting it. Then I say this. I said, that's equivalent of saying, my friend died in a car accident, had a seatbelt on, so I'm not wearing seatbelts anymore. It's the exact same thing. And every time I say that, everybody agrees. You're right. That's equivalent of that. So yes, you want to protect yourself. Nothing's 100% except the number 100%. But you want to put yourself in the environment to where you have a better chance. So that's one of my messages, you know, and one of my barbers is still anti-vax, right? Because, you know, he feels certain things still. And we were talking about in the barbershop and I said, we're here talking about the vaccine, knowing that my partner isn't here. And the fact we don't know is if he got the vaccine, we don't know if he survived or not. But the fact we do know is he didn't have the vaccine and he passed away. How much more do you need to know? You know he's not a hoax. You know his death is not a hoax. And you know him and love him. So what are we talking about? You know, that's my strong message to everybody and anybody who is watching this.
Denise, give your best message also, please.
I don't know how I can top that because that's very real. But it still goes back, and he and I agree on the same thing. How bad do you want to live? The other thing is, we know statistically now how many people have gotten the vaccine. We have more people that are alive, we believe, factually based, because of the vaccine. There are millions and millions of people here that have gotten the vaccine and they're still alive. And it has allowed us to open up the doors so that we can maybe be with people. Yes, we still need to kind of mitigate. We still need to wear the mask. We still need to be careful. But one thing I'm a firm believer is you can mitigate all you want. You can wear masks all you want. But without that vaccine, what are your real chances? Yes, you can have breakthrough. And now we have another variant. We're going to probably have variants for a while. That's my belief. But I'm hoping that we'll get to the point that we'll go from a pandemic to endemic like the flu. We get a flu shot every year. Yeah. And a lot of people still tell me now, I don't get the flu shot. And I always ask them, do you get the flu? 8 out of 10 get the flu.
Right.
Ask me if I've gotten the flu. I get a flu shot every year, and I never get the flu. It's just not worth sniffling and sneezing and being sick because people still die from the flu. So if you can die from the flu, what do you think is going to happen with COVID?
Amen. Denise, Robert, thank you both very much for being here. We really appreciate your stories, and thank you so much.
Thank you.
Thank you.
Thanks so much to Robert Taylor and Denise Ogletree McGuinn for sharing their COVID testimony with us. COVID-19 testing and vaccination sites are located in many locations in Clark County, including one at UNLV in the parking lot of the Paradise campus, 851 East Tropicana Avenue, across from the Thomas and Mack. This site operates Sunday through Thursday from 5:30 p.m. to 10:30 p.m. It's first come, first served, and of course tests and vaccinations are safe, effective, and free. Additional vaccination sites, including pharmacies, are found on the Southern Nevada Health District's website at snhd.info/COVID-vaccine. And the public is encouraged to call the state's vaccine hotline at 1-800-401-0946 or go online to nvcovidfighter.org. I'm Randy Swallow. Thanks for watching COVID Conversations on Clark County Television.